Is this magic in a bottle? Probably. And it works like magic in a bottle. So this is semaglutide. It's a compounded version of the original medication, Ozempic. It works awesome, and a lot of people have gotten significant relief from their weight challenge, from being unable to lose weight with these GLP-1 agonists, in the sense that they are able to now achieve what they couldn't achieve before. So the question is, how long can you be on these medications? And this is the question that most researchers and studies and doctors are actually asking themselves, and patients are asking themselves as they've been on these medications for 6 months to a year and a half. Can we now get safely off the medication and see what happens? Well, we know for a fact that if you abruptly discontinue the medication, you have about 6 months to 3, maybe even 3 to 6 months, somewhere in that range, your weight will come back, minus about 10 to 15% of it. So there is some persistent weight loss, but you're not going to be at the weight that you had when you were on the medication. We think it's actually better to wean down the dose that you're using, space out the injections, so wean down to a minimum dose. As long as the weight loss continues and stays stable, then so you don't lose any more weight, but you're stable and you're not gaining it, you can keep that low dose every 2 to 3 weeks, maybe once a month. We don't know. Everybody is unique in what's going on with them. But long story short, if you've used this medication like an appetite suppressant, just like phentermine or another medication, and you haven't addressed the issues that led to the problem, then the truth is your weight will come back. So continue working with your physician, continue addressing the problem that led to the weight issue that required the medications, and be aware that checking your body mass composition and looking at your skeletal muscle mass, it's a crucial part of this treatment. And it's heartbreaking that I see a lot of patients on this medication that don't have any idea what their body mass composition is. But as we get older and we lose our muscle, that's a devastating consequence. And it might not be apparent when you're 50, but it will be when you get to 60 and 70, and then you make it to 80, and then you can't really build muscle at that point. So it could have devastating consequences. So long story short, we don't know how long we can be on these medications safely, because they've only been on the market for a few years. Most recommendations are somewhere between a year and a half. And then try to wean it down rather than discontinuing abruptly. So work with your doctor, work with whoever is managing this. Hopefully you're not doing one of those online sites, and you actually have a physician that cares for you and is monitoring all these things and is helping you deal with what's going to happen when this medication runs out.